we do recognize National Recovery Month this September. And a couple of weeks ago, I had the opportunity to attend a vigil recognizing loved ones that were taken from us at far too young of an age because of opioid addiction. This disease is cruel and does not discriminate against anyone. Right now in Veterans Plaza, in our right next to our executive office building in downtown Rockville, are the images and pictures of wonderful, beautiful people, again, taken from us too soon. What struck me about that event was both the sadness and the absolute crushing tragedy that the families all felt, but also the resilience of those families and the resolve to address this issue moving forward. Joining us this morning are my colleagues from our Health and Human Services Committee, Councilmembers Evan Glass and Councilmember Craig Rice. We also have joining us Dr. Raymond Kroll, our Director of the Department of Health and Human Services, Ben Stevenson, the Chair of the Opioid Overdose Team within DHHS, Laura Mitchell, the Chair of the Alcohol and Other Drugs Advisory Council, Megan Westwood, Executive Director of the Maryland Treatment Centers with the Avery Road Treatment Center, and we will hear most especially from Amy Bormel, an employee of the Maryland Treatment Centers within Avery Road, who will share her personal story and journey. So it is a tragic situation that we find ourselves in today, and we know that COVID has exacerbated an already extraordinary challenge with people in isolation and not able to access the services or be able to embrace the loved ones and support system that we all need, but especially those facing this terrible disease. I now want to turn it over to my colleagues to say a few words. I will first turn to my colleague, Councilmember Craig Rice.
Well, thank you very much, Council Vice President. And I couldn't say it better than you have in framing the discussion. I will just add that when we think about what's facing our community, our worldwide community right now, we have social unrest. We have a political divide. We have the COVID crisis. We have climate change. So many things that are affecting people's well-being, and they're just grasping with all of the challenges. Just one of those alone, dealing with the racial unrest that we had with George Floyd and Breonna Taylor, and you can go down the list, has affected so many in our community, not just African Americans, but all across the board, who understand that there's so much that's happening and we need to do more to make sure that our community becomes a more welcoming and inclusive place. When it comes to climate change, especially for our children and young people who are battling with whether or not our world will be here for them when they grow up, and if they choose to have children, what will be there for them. Those are things that are undaunting when it really comes to how folks can process and deal. And so, of course, we are going to see a rise in terms of people who are challenged, who unfortunately aren't getting the help. And so that's why I'm really happy that we have leaders in our community that are with us here today, receiving this proclamation, but also that are here on this council, who understand the need for us to continue to support and provide mental health services. The reality is that there's so many that are undiagnosed in our community who are experiencing challenges. And so I want to take this opportunity that if you are feeling down, if you see that you're experiencing a time that is challenging, talk to someone. Please reach out. Services are there. People who care about you will be willing to help and assist. You're going to hear stories about people who ended up having their lives saved because of people who they didn't know, who were there to help and support them. We are all here for you. We all understand this is an incredibly tough time, and we all want to make sure that we can help each other through these difficult times. And so with that, I'll turn it back over to you, Council Vice President.
Thank you so much. Councilmember Glass.
Thank you very much, Mr. Vice President, and to everyone for joining us this morning, because we know that for far too long, and especially over the last 18 months, too many people have been suffering at home in silence, and some with family members as well. And this is a really important month, National Recovery Month, to lift up, because it's so important to spread the word about prevention and treatment and recovery for substance use and mental health as well. And I'll add that while we're talking about individuals who are receiving in the middle of recovery, who might need recovery, it's also important during this time to thank our treatment and service providers, because collectively we are all trying to educate everybody about addiction treatment, about mental health services, so that everybody can live healthy and rewarding lives. And Mr. Vice President, I appreciate you leading this proclamation so we can get that word out, that behavioral health is a good thing for overall health, because prevention, intervention, and treatment works. So thank you very much.
Thank you so much, Councilmember Glass. We are also joined this morning by Dr. Raymond Kroll, the Director of the Department of Health and Human Services. Dr. Kroll, I turn it over to you to say a few words as well.
Good morning, Council Vice President Albornoz and Chair. Thank you all for taking the time to recognize this issue for us. You know, you and I both had the experience of sitting at a memorial service a few weeks ago. That was both painful and a joy to see that people are remembering and keeping the spirit of those that we've lost to this overdose epidemic alive, and keeping our eyes focused on that issue. This epidemic has not stopped its work on our lives during the pandemic, during the COVID pandemic. And so it's appropriate that we remember this in this moment. I just want to say a special thank you to Ben Stevenson and members of our staff in HHS, but also to Maryland Treatment Centers, to the Collaboration Council for their work on this, to the entire overdose intervention team, fire and rescue, police, pharmacists, concerned community members who dedicated time throughout this pandemic to working on this issue of opiate overdose deaths and intervention, and to those who are, to you on council for continuing to raise this issue and be aware of it. And thanks to the committee for all the time and energy that we've put into this over the last year. It has been a hard lift, and we have lost ground during the pandemic, during our pandemic, but we have not given up this fight, and we will continue to struggle. So I'm appreciative of this moment to call awareness and attention to this issue. Thank you.
Thank you so much, Dr. Kroll. Well said. So one of the lights that I've personally had the opportunity to experience was the ribbon cutting of the Avery Road Treatment Center a few months ago. It is a magnificent facility. And the highlight of that event for me was hearing from Amy. She shared with us her personal story, and it's so important to hear these stories to eliminate the stigma associated with this disease and just the strength and resilience of so many who are impacted by it. And you're not going to have a better example of that than Amy. So Amy, we are honored to have you here this morning. If you could please with us share your story, we'd appreciate it.
Thank you so much, and good morning. So as a woman in recovery, it's truly an honor to be here today. Just over 4 years ago, I walked into Avery Road Treatment Center, completely broken, hopeless, and thought there was no way out from my addiction. For about 10 years, I was in and out of treatment facilities and jail cells, and my disease continued to progress until I hit rock bottom. Just last year, over 93,000 people lost their lives to this disease. Sadly, we are seeing fatal overdoses nationally across the state and here in Montgomery County rise to pre-pandemic levels. We must double down on our life-saving efforts. I consider myself lucky, as I easily could have been a part of that statistic. My recovery has definitely been a process, but throughout the past 4 years, I've become a strong, reliable, trusting, and confident woman, daughter, friend, and employee. Last year, I had the opportunity to come work for Avery Road Treatment Center, and I'm now a part of a team responding to overdoses throughout the county. Earlier this year was the opening of the new treatment center building, which has given even more people just like me a chance to get the help they need. By staying connected with the staff and alumni and the entire recovery community, both as a professional and a grateful recovering addict, I'm confident that I'll have the life I always dreamed of. Throughout National Recovery Month, I hope we can continue to bring awareness, reduce the stigma of addiction, and help more of our family and friends into a life of recovery. I would like to thank the County Council for inviting me here today and for making treatment and recovery a priority of this community. I hope that together we can continue to remove the stigma from this devastating disease and to provide the supports and services that allow people to recover and strive. The message you send here today is so important. We value all of our community members. We believe people get better, and we support you. Thank you so much.
Okay, Amy, that was awesome. We're giving you a virtual standing ovation this morning. That was beautiful and powerful. All right, we're going to read this proclamation now. Myself, Councilmembers Rice and Councilmember Glass. So I'm going to kick us off. Proclamation of the Montgomery County Council. Whereas National Recovery Month is held every September to educate Americans that substance abuse treatment and mental health services can enable those with a mental health and/or substance abuse disorder to live a healthy and rewarding life. And
whereas the 2021 National Recovery Month theme is recovery is for everyone, every person, every family, every community, reminding people in recovery and those who support them that no one is alone in their journey through recovery. And
whereas since 2016, over 60% of overdose fatalities in Montgomery County have been related to fentanyl, with substances being altered or laced with fentanyl and people being unaware of what they are purchasing. And
whereas the COVID pandemic has had a major impact on the increase in overdose fatalities, with more people experiencing social isolation, anxiety, and depression without traditional access to services. And
whereas there has been a 50% increase in overdose deaths, including drugs and alcohol, between January and March of 2021, compared with the same time frame in 2020. And in FY21, 84% of all fatal overdoses in Montgomery County have been related to opioids. And
whereas county resources and key stakeholder partnerships have strongly focused on telehealth options, increased prevention efforts, and the expansion of harm reduction services, including Good Samaritan law education, community awareness campaigns, youth ambassador programs, law enforcement take back drug efforts, and increased Narcan partnerships with DHHS, fire and rescue, and community-based organizations.
now therefore it be resolved that the County Council of Montgomery County, Maryland hereby recognizes September 2021 as National Recovery Month. And be it further resolved that the County Council calls upon all its residents to acknowledge and celebrate the lives transformed by recovery and the message that prevention works. Treatment is effective and people can and do recover. Presented on this 14th day of September in the year 2021, signed by myself and our council president, Tom Hucker.